Well, it's time for our health report. Joining us now is Africa 54 health correspondent Linord Moudou with latest news on the ills of smoking. Hello, Lino.
Hello, Vincent. The World Health Organization says people should be more aware of the dangers of smoking. According to the WHO, tobacco use is a key risk factor for heart attacks, strokes, cancers, diabetes, asthma, and other chronic diseases. Together, they account for 60% of all deaths worldwide. Such diseases are expected to account for 46% of deaths in Africa by the year 2030, up from 25% in 2004. The agency wants to encourage users to stop smoking and prevent other people from becoming addicted to tobacco. Dr. Douglas Becher is WHO's Director for Prevention of Non-Communicable Diseases Department.
The tobacco epidemic is a man-made disaster of unprecedented proportions. The fact that one person dies from a tobacco-related disease every 6 seconds, that's equivalent to a jumbo jet falling out of the sky every hour. 6 million deaths per year, and if we continue this business as usual, that could amount and add up to an unprecedented or horrific toll of 1 billion, almost unimaginable, 1 billion deaths from tobacco-related diseases this century.
And the tobacco epidemic is a man-made disaster of unprecedented proportions. The fact that one person dies from a tobacco-related disease every 6 seconds, that is equivalent to a jumbo jet falling out of the sky every hour, 6 million deaths per year. And if we continue this business as usual, that could add up to a horrific toll of 1 billion, almost unimaginable 1 billion deaths from tobacco. And that's what the director says from WHO. WHO says that by increasing tobacco taxes by 50%, all countries can reduce the number of smokers by 49 million within the next 3 years and ultimately save the lives of 11 million people. And a lot of people start smoking when they are teenagers, only to find later on that they can't kick the habit. It's a huge public health concern. As a result, researchers the world over, in government and in private institutions, are working on ways to help people stop smoking. More from VOA's Pearson.
In Joanna Cohn's office at the Johns Hopkins Institute for Global Tobacco Control, cigarettes come in all types of packages. Some are gruesome, others are beautiful. With advertising restrictions in so many countries, cigarette companies are using the packages as advertising tools. Governments use them to discourage smoking. Researchers like Cohn say taxes are the best incentive in cutting back on smoking.
Taxes are a win-win situation. So smokers smoke less, so it's better for their health, and governments increase their revenue. So taxes really are our most effective strategy and a win-win proposition.
The World Health Organization is urging governments to increase taxes on tobacco products. The WHO says higher taxes are especially effective in reducing tobacco use among lower income groups and in preventing young people from starting. The organization says a 10% tax increase reduces tobacco use by 4% in high-income countries and by up to 8% in most low- and middle-income countries. Statistics show there are 1 billion smokers in the world, almost 1 out of 5 people. Tobacco kills up to half of its users. Some people say if tobacco were banned, they wouldn't smoke at all.
I've been a smoker for 38 years. It's something that's been so hard for me to stop on my own.
Others say they're so addicted they have to smoke, even if they know the health risks.
One of the worst addictions in the world is cigarette smoking. And inside my heart, something is telling me that I need to quit. It's not the right thing that I'm doing to my body and to the ones around me.
Joanna Cohn says governments also have to introduce more strategies so those trying to stop can be successful.
70% of smokers say they want to quit. We just need to figure out strategies to help support people in quitting in terms of reducing queues, making the product more inaccessible, harder to get, more expensive, and just supporting less advertising, less promotion, those sorts of things.
Public health experts expect deaths from tobacco use to increase in the years to come, especially in low and middle income countries where most of the burden of tobacco-related disease is expected to occur. These experts are hopeful, however, that as proven strategies to prevent smoking are introduced, fewer people will take up the habit. Carol Pearson, VOA News.
And joining us live via Skype from Accra, Ghana, for more on the subject is Joshya Kyallo, Director of Africa Programs of the Campaign for Tobacco-Free Kids, a Washington, D.C.-based organization. Mr. Kyallo, welcome to the program.
Good evening, viewers.
Let me have your take on this. To what extent do you think that the tax increase on tobacco products can help decrease the use of tobacco?
There is scientific evidence based on global experience that the most effective way of reducing tobacco consumption is through taxation. What happens is as you increase tobacco taxes, the price of cigarettes would go up. And as you said earlier on, there are three-win situations here that you're able to stop young people from initiation into smoking. Secondly, you get revenue for the government. And thirdly, you are able to get the government to perhaps put some money for public health to address the deadly consequences of tobacco use. So it is a very effective measure.
So the organization you represent focuses on the young people. To what extent is this a problem among this population?
Well, I think overall across Africa, let's not make a mistake. Tobacco kills, causes disease and disability. And in fact, for Africa, we now know that it kills far more people around the world than HIV, AIDS, tuberculosis, and malaria combined. And therefore, we see the tobacco industry is always targeting young people through its very sophisticated marketing strategy. And therefore, the race is on to get young people to stop smoking and not to initiate into smoking. That's why we are calling for African government to put in place laws, policies that are very effective in preventing the use of tobacco to prevent death, disease, and disability.
And very quickly, where should the focus be? In preventing young people from smoking or helping those who smoke already quit?
I think overall, every strategy matters a lot, but I think prevention is better than cure is a famous saying all around. It's a big public health agenda we have. And if we can stop the supply of these profits for the tobacco industry by cutting off the initiation to smoking by young people, I think we'll have done a lot for public health across Africa. And generally speaking, as far as Africa is concerned, the rates are relatively lower compared to the rest of the world. But we have an opportunity and a very small window of opportunity to prevent an epidemic on the continent. So the race is now for prevention, targeting young people, but also putting in place strong national laws that are compliant with the World Health Organization Framework Convention on Tobacco Control.
Okay, Mr. Kyallo, that's all the time we have. Thank you so much for joining us from Ghana.
Thank you for having me.
And our thanks to Joshya Kyallo, Director of Africa Programs of the Campaign for Tobacco-Free Kids. He joined us live via Skype from Accra, Ghana. And that's our Africa Health Report for today. Back to you, Vincent.
Well, thanks a lot, Linord. Be sure to watch Linord Moudou's Health Report every Tuesday and Thursday right here on Africa 54.